Hi, my name is Cary Shiwarski, and I am an instructor of medicine in the Renal Division of the Department of Medicine at the University of Pittsburgh. I am board-certified nephrologist, and 20% of my time is spent interacting with patients, both in the outpatient clinic and in the inpatient setting. Broadly, I focus on patients with chronic kidney disease, end-stage renal disease, and hypertension. The other 80% of my time is spent doing basic science research. My current research focuses on how dietary potassium affects blood pressure. During my PhD, I decided that I wanted to obtain my MD, so I began applying to medical schools. The University of Pittsburgh and the PSTP program were the perfect fit. I joined the PSTP program in 2007. I was able to incorporate ongoing research, journal clubs, and work with mentors, all during medical school training. After medical school, I continued to split my time between research and medicine by joining the research pathway through the American Board of Internal Medicine. This program allowed me to combine my residency and fellowship with designated time for research. I have completed my fellowship, and I am now a T32 funded scholar within the Renal Division, and I anticipate that I will soon be transitioning to a KO8 award from the NIH. The KO8 is a career development award that will allow me to gain independence as a researcher. Within the next 5 years, I plan to apply for my first NIH R01 with plans to transition into my own laboratory. Some great advice I was once given about overcoming challenges as a physician scientist was to avoid getting lost in the minutiae of research. It's easy to ask more and more questions about smaller and smaller things. Rather, when you get too deep into a problem, you should take a breath, take a step back, and ask how your research fits into the big picture. How can you apply your research to human physiology? This helps frame the questions I ask and keeps my research on track. By framing questions this way, I have found it helps others get excited for my research and helps with writing grants and manuscripts. During my training, one of the greatest challenges has been finding time for both research and clinical training. I intentionally have sought out both programs and mentors who understand the challenge and have great advice for finding balance. I find that research is the marathon, where it may be years before I see the fruition of my work, whereas my clinic is the sprint, when I can interact with my patients and immediately make a change. Both inspire me to continue pursuing the other. My clinic inspires my research, and my research inspires me as a clinician.